Hi there, it's Dr. Buford. We're just getting started on the right knee. We're just zooming in a little bit so we can see a little bit better. And then we'll also try and turn up our brightness just a little bit. Now what we're looking at here is the medial compartment. This is the inside of the knee. Everything's magnified, even more than 30 or 40 times now that we're zoomed in. So we're getting a real bird's eye view of the meniscus here. We've already taken out one little loose piece that just floated by. Loose piece of cartilage, that is. And as we look here at the posterior horn of this medial meniscus, that actually looks pretty good. We'll probe it in a bit. So I'm actually pretty happy. There's another loose piece. See that right there? So I'm not too surprised. The meniscus here, I think we're hoping would be okay. It's some of the other areas of the knee that are generating these loose pieces that we need to get sorted out for you. Possibly. Okay, so this is the compartment that we're the most concerned about. We've got some radial tearing in the lateral meniscus. We're in the lateral compartment. But also I think what we're going to see is that all these loose pieces are coming from this lateral compartment. Maybe the patellofemoral compartment a bit also, but certainly from here. Here we can see an area, several areas where this is where this is loose. And this is the problem here. I'd like to trim back what I can. With this type of injury, a lot of times there's parts of the cartilage that we can't see that are still not quite healthy. Certainly this is where some of those loose pieces are coming from. Okay, we'll take a basket forceps and swallow it. We'll try and trim that back for you if possible. Okay, so we've cleaned up the edges of this defect in the condyle. You can see the edges are pretty stable now. There's nothing really loose hanging down. So obviously we can't cure the problem. We don't have a way to just resurface this. But the next best thing is to try and create a little bit of vascularity here to get that to heal over a bit. And that's what we're about to work on next. Now we're looking here at the patella. This is your kneecap, and it's got a lot of fraying underneath it also. We're just using the shaver to smooth it out as best we can. You can see all these loose pieces that float into view, and they're removed from the knee because we have suction on the shaver. See some of these loose pieces here floating around. About done here. We'll go ahead and put in a cannula to remove some of these bigger pieces here. Pause.